Welcome, everyone. Just so delighted that you're all here. And our wonderful speaker is here to share with us with her deep knowledge of yoga, and in particular, yoga for dementia patients and caregivers, which couldn't be a more right on topic as far as I'm concerned. Um, we are recording this video, and you can go back and listen to it again, or if you have to leave. Um, and it is just on the hour now, and we have a hello from Carlotta. Anyway, just welcome to all of you, and I'm going to turn it over to Alexandra right now.
Hello, everyone. Let me get my screen share set up here. Okay. Thank you for having me. My name is Alexandra Mohammadi. I am a physical therapist down in Santa Barbara, California. I got connected with Daybreak through one of my favorite people, my professor, Jason Hardage, from my doctorate program in physical therapy, who's down on the right side of the screen here. But before I was a physical therapist, my first career in movement was yoga. I did my yoga training in Northern India, in Rishikesh, India, back in 2013. And I have since found many ways to bring the two together, physical therapy and yoga. And today's presentation is meant to just be the tip of the iceberg on what yoga is and what it might offer to you or to those you care for. My presentation is a little bit more aimed at the caregivers than the recipients, but I'm happy to answer as many questions as I can or clarify anything for those receiving care and yoga as well. And before we dive into a bit about yoga and what it is and how it might fit into your needs in your life, we'll be talking a little bit about why we need to pay attention to yoga for caregivers in the first place. And you can expect also a little bit of yoga practice throughout the next 45 minutes or so. Some short practices built into the talk, a little bit of a longer practice at the end, and then I'll save about 15 minutes at the end for questions as well. So why do we need to focus on yoga for caregivers? When we look at the research, we find that caregivers have high rates of depression. They report having high rates of emotional strain from caregiving and overall lower subjective well-being. And then on the physical side of things, there's often higher levels of obesity, high levels of bodily pain, and high levels of physical strain. Your jobs are obviously taxing, right? From an emotional standpoint, whether it's someone that you're taking care of that's a family member or a loved one, or if it's a career, it can be challenging emotionally. And then physically, you're running errands, doing things around the house, physically helping the person that is requiring care. So I'm sure none of this is a surprise. And there's the old cliche that you can't take care of others until you take care of yourself, right? This is a quote from Bryant McGill. He's an author. Taking care of yourself is the most powerful way to begin to take care of others. And that can be challenging for all of us. And I have some tips at the end on how to fit in caring for yourself in the midst of caring for someone else. So we are going to come back to that. But I'm hoping what you'll find today is that it's quite simple to sprinkle in little bits of yoga practices into your daily life. So what is yoga? I'm going to start by saying it's a million things. And there are plenty of people who study yoga philosophy who would listen to this webinar and say, yeah, right on. And plenty of others who would say, no, that's not my understanding of it at all, which is typical for something that's so old. It's been around for thousands of years. And of course, there's been segmentations of the practice since it came to be. So there are a million different philosophies, takes on it, methods of practice. And my intention is to give you a bit of the basics so that you can take it and run with it and hopefully find the niche that works for you. But from a broad perspective, yoga, the word itself means to yoke together. Yoke is in the apparatus that's connecting these two cows here. And this can be interpreted as the union of the mind with the body, the self with a greater consciousness or God. There's many other interpretations. And because there's so many different interpretations, so many different types of practice, it means there's also something for everybody. It's just a matter of finding out what works for you. And so why might yoga help with all of those things I talked about at the beginning? The issues that a lot of caregivers find themselves to have. And briefly, I just want to mention this idea of the biopsychosocial model. So this is an approach to healthcare that basically says that we need to be paying attention to the whole person, right? Our biological needs do not live on an island separate from our psychological needs or our social needs. And so if we have something negative going on in our lives from a biological perspective, it might impact these other areas as well. But also if we have something negative going on in one of these arenas, doing something positive in another might have that ripple effect outwards. So our bodies, our psychology, our social lives, they all interact with each other. And we should really be paying attention to all of them. And then what we find in a yoga practice is that it does have that ripple effect. And the evidence says so. So this evidence I'm speaking of here is specifically studies that are looking at yoga and caregiving. So it can reduce stress, reduce depression, fatigue, and anxiety, while also increasing the quality of life, increasing sleep quality, and increasing self-compassion. This idea of there being 8 limbs of yoga or 8 aspects of yoga comes from one specific yoga guru. And I find it's just a nice, concise way to discuss the philosophy. And we're only going to be talking about a few of these today, starting with the asanas, the postures. And this is what we tend to think of when we think about yoga in the West, right? The asanas were initially developed, story has it, by yogis who were meditating and their bodies couldn't handle being still for that long. Limbs would fall asleep, joints would start to ache. Our bodies need movement, blood flow, space in order to be happy, right? And so they developed these postures as a means of continuing that meditative state, but adding movement to it. So it's really meant to be a movement meditation. And they took inspiration from animals around them to create these postures, which is why so many of the postures have animals in their names. So we're going to do our first little bit of movement practice right now, just for maybe a minute. And everything we do today is going to be from a seated position. If you're standing, you can do it standing as well, that's fine. But without knowing about everybody's bodies and needs, I figured seated would be the way to go. So you can sit up nice and tall. And if you want to follow my verbal instruction, I welcome you to close your eyes. You can also keep your eyes open on the screen if you like to. Bring your arms down by your sides. And then on an inhale, can you reach your arms all the way up to the ceiling? Take a breath in. Really get your arms nice and long, like you're trying to touch the ceiling. And then with your hands together, exhale and bring your thumbs to your heart. And then again, inhale, reach your arms up. You can look up at your hands if that's available to you. And then exhale, bringing your hands down. And then pausing for a moment here, close your eyes if it's available to you. And I just want you to feel. So bringing your attention to the body, bringing your attention to any shift that's happened just in those 2 rounds of breath. Trying your best not to put any judgment on what you're observing, but rather reporting on what's happening, like a weatherman might report the weather, weather person might report the weather. And arms by your sides again, reaching your arms up one more time. Inhale. And this time when you exhale, bring your arms out to the side as if you're forming a goalpost type of position. Staying here for a breath in, feeling a stretch across the front of your chest. And then on the exhale, I want you to give yourself a hug. Wrap your arms around yourself, curl in, bringing your chin down to your chest. Inhale, open up. Arms out to the goalpost. Exhale, give yourself a hug. Maybe switching which arm's on top. And then inhale one more time to the goalpost position. And then exhale, arms down again, palms face up on your lap if you're seated, or facing the same direction as your front of your body if you're standing. And shutting down your eyes just one more time. Absorbing the effects of that short practice. And again, just tuning into your body. Not trying to change anything about your experience, but simply acting as an observer. And when you're ready, you can come back to your screen. So the asana practice can be short. It can be quite simple. An easy thing to just fit into your day while you're waiting for your coffee to heat up. Or standing in line at the grocery store if you don't mind what people think about you, like me. And there's a lot of different categories of the practice. So I think what a lot of us think about when we think about yoga is a really sweaty studio with people in expensive leggings doing acrobatics. And that is definitely some types of practice. A vinyasa practice, which tends to be a little more physically intensive and a bit like a dance, might look like that. But there's so many different categories. So a yin practice is a practice in which you're holding a stretch for a few minutes at a time, really relaxed. A restorative practice uses a lot of props to set yourself up in positions that allow your body to really just melt into the ground. Ashtanga was something developed for teenage boys in India. That one's what I call CrossFit yoga. And then Iyengar yoga is made for people who have physical impairments, physical disabilities, and they use a lot of different props to allow the body to still get the benefits of what otherwise might be a too challenging of a practice. Chair yoga, a bit of what we just did, and so many more. So there's a ton of variety, and there truly is something for everybody. Okay, another limb of yoga is called pranayama. So prana is the equivalent of qi in traditional Chinese medicine. It's the energy within us, our life force energy. And in yogic theory, we have thousands and thousands of channels that this energy flows through. And the energy can become stagnant or stuck or moving too fluidly. And by using our breath, we can control how that energy flows throughout the body. So that's the short summary of the yogic philosophy behind it. But when we look at the research behind it, what we find is that it brings balance to what's called the autonomic nervous system. Our autonomic nervous system has two components. It has our fight or flight system, right? The system that's really active when we are in an acutely stressful situation. And then the rest and digest system, the system that's really active when we're at peace, right? At rest. And a lot of us these days are living in a more chronically elevated fight or flight system, a little bit of chronic stress. And we know that's linked to a lot of the issues that I brought up at the beginning of our talk today. And so what we find is that pranayama helps to find a balance between these systems. Ideally, we have an acutely stressful situation and then the systems balance themselves out, but that doesn't always happen. And so pranayama helps us to balance those out. There are a ton of different pranayama practices, different ways of breathing. And really when you're doing an asana practice, ideally there is breath coordination. So you're getting the benefit of finding that nice even breath flow as you're doing your movement meditation. but it can also be done as a standalone practice. And we're going to do another brief practice here, and this is called box breathing. Box breathing, you breathe in for the same period of time, but you then hold your breath on the inhale, breathe out for that same period of time, and then hold your breath or hold out breath before you breathe in again. So we're going to do that with 4 seconds. So 4 seconds in, 4 seconds of holding, 4 seconds breathing out, and then 4 seconds holding out before you breathe in again. So I'll invite you again to take a nice tall posture. You can do this again seated or standing. And if you're feeling the type to feel at all lightheaded, please stop. I would hope no one would. I never had anybody feel lightheaded with this box breathing, but be responsible for what your body is telling you. And again, I'll invite you to close your eyes if you can, if it's available to you. If not, you can turn your gaze slightly downward toward the tip of your nose. And then when you're ready, I'll have you breathe in for 1, 2, 3, 4. Hold, 2, 3, 4. Out, 2, 3, 4. Hold, 2, 3, 4. In, 2, 3, 4. Hold, 2, 3, 4. Out, 2, 3, 4. Hold, 2, 3, 4. And continue like that for maybe 5 more cycles. And when you finished your last cycle, you can bring your attention back to the screen. So that's a really simple practice. You can do that on the bus. You can do it in the doctor's waiting room. I do this one before my doctor takes my blood pressure so I can be a good student. It's a really impactful, really simple way to help find that balance with the autonomic nervous system. The last piece that I want to talk about is not necessarily tied to any one of the 8 limbs of yoga. There is one of those limbs of yoga that often gets translated as meditation, but really the meditative aspect of yoga involves so much more than that, and components from all of the other limbs of yoga. Modernly, we really clump together mindfulness in a lot of yoga practices and a lot of yoga studios. And I'll be clear that they're not the same, but there's a lot of crossover between them, between meditation and mindfulness, but also mindfulness and yogic philosophy. But they're not the same. I'm using mindfulness because there's a ton of evidence behind it. And I find that it ties in really, really nicely with the yogic practice. So mindfulness, I find it's one of those words that it's kind of like holistic. Like we use it a lot, but do we really know what it means? So put simply, it's the awareness that arises with paying attention on purpose to the present moment without judgment. So when we were doing our brief asana practice about observing, right? You're observing your experience without necessarily judging it, observing it like a meteorologist observes the weather without trying to control the weather. That's the without judgment component of it. And boy, is there a lot of evidence for mindfulness. It's very, very clear. This is my niche in my physical therapy practice. I use mindfulness for chronic pain conditions, and there's a ton of evidence for that. There's evidence that it improves the pain threshold, but it can also improve stress levels. There's a program called mindfulness-based stress reduction that has been used since the late 70s in a ton of studies for all sorts of conditions. Obviously, stress is in the name for that one, but it's also been used in studies for sleep quality. It was used against Lunesta in a randomized control trial for chronic insomnia and outperformed Lunesta. It can improve communication and improves our metacognition, right? Our awareness of why we're thinking what we're thinking or doing what we're doing in the moment that it's happening, which I know is hugely impactful for me in my work with my patients. And I'm sure would be impactful for you in your work with your patients as well, or your clients, patients, family as well. And then again, if pain is part of your life, especially persistent pain, it's been shown to be incredibly effective for helping to alter that relationship as well. So we're not going to do any isolated mindfulness practice or meditation, but I am going to be using those concepts as we move into a bit of a longer practice here in a moment. Let's pause there for a second. So I think what makes the most sense now, just seeing if there's any questions I should answer really quickly before we get going, is to jump into a bit of an extended practice. So we'll be doing this for maybe the next 10 or 15 minutes. The only rule I really have is if it doesn't feel good, don't do it. What you can do in those situations is do something that might feel good for you. But you can also, there's also a lot of power in imagining yourself doing whatever that thing is. So literally closing your eyes and picturing your body doing that posture or movement. So be kind to your body, give it what it's asking for. This is not a space to push yourself unnecessarily. And we're going to stick to chair yoga. Everything we're going to do, you can do in standing as well. So I'm going to have you start by sitting up nice and tall, shutting down your eyes if you can. Palms on your lap. You can have them face up or face down, whatever feels right for you right now. Feet on the floor if they can reach. And you're going to start just by paying attention, bringing that awareness first to the breath. And an awareness, again, that is non-judgmental. You're just observing the breath, observing the qualities of it without trying to necessarily change anything about the breath. So you can notice what parts of you are expanding upon the inhalation. Is it your abdomen, your chest, maybe your shoulders? Are you breathing through your mouth or your nose? Is your breath shallow or deep? And maybe you can even try to follow your inhalation from the tips of your nostrils up through your nasal chamber, down your throat as far as you can into your lungs. And then gently redirect your attention to your body. Briefly just scanning your body from the crown of your head, down your face, shoulders, chest, torso, hips, legs, feet, your hands and arms. And again, just noticing, observing, reporting on what you find, and trying your best not to judge what you're finding. And if you are judging what you're finding, even more challenging is to not judge yourself for judging yourself of what you're finding. And notice if there's anywhere in your body that is holding tension unnecessarily. And if there is, you can gently try to direct your breath there. See if you can, with ease, release some of that tension. And if that's not happening for you today, then letting that be okay. And bringing special attention to the bottoms of your feet and the palms of your hand. If there's any gripping happening, can you breathe there? Consider letting it go. And maybe gently wiggle your toes, feeling each one. Wiggle your fingers. And then you're welcome to keep your eyes closed if you like to, and just listen to my words, or you can bring your attention to the screen. I'm going to keep my eyes closed. Can you inhale, as we did before, reaching up? Getting nice and tall. And exhaling, hands to your heart. Already taking a moment to bring attention back to your body, just briefly. And again, lift your arms up overhead, breathe in. And then exhale into that same goalpost position with your arms. Letting your arms come down by your sides. Again, briefly checking in with the body. And leaving your left arm down by your side, can you reach just your right arm up to the ceiling? And then really try to get your fingertips to touch the ceiling, finding that as you do that, your torso starts to bend to the left. Getting tall, getting long in your right side body. Pushing your right buttock down into your seat or your right foot into the ground if you're standing. And breathing in toward the right armpit. You're welcome to look up at your right hand if that feels good for you. And then after you exhale, bring the right arm up or left arm up to meet the right. Inhale here. And then bring your arms down by your sides. Again, taking a moment to notice the effects of that brief stretch. Any asymmetries you might be noticing now from your right side to your left side. And then switching. So inhaling, bringing your left arm up to the ceiling. Reaching your fingertips toward the ceiling as if you're trying to touch it. Noticing that you'll bend over toward the right side as you do so. Getting long in left side of your body. And trying not to get too crunched up, or on the left side of your body, and trying not to get too crunched up on the right side of your body. Looking up at your left hand if it feels good for you. And breathing into your left armpit. Inhale here. Exhale. Inhale, bring your right arm up to meet the left. And exhale, arms down by your sides again. Taking a moment to absorb the effects of that stretch. And now I'm going to turn to the side. You can stay as you are. Bring your hands to your knees or the tops of your thighs, palms facing down. And if you inhale, can you gently tug on your legs so that your chest comes forward between your arms? If you're standing, you're welcome to just bring your sternum up toward the ceiling. And then exhale, push into your thighs and round your spine. Bringing your chin into your chest if it feels okay for you. If you're standing, you can just give yourself a hug and curl in. Inhaling again, bringing your chest through your arms, shoulder blades together, chin up. Exhaling, arching your back like a cat. One more time. Inhaling, bringing your chest through, noticing what's going on in your body. And exhaling, pushing your hands into your legs, arching your back. And then coming back to neutral, resting your hands more gently on the tops of your thighs. And once again, observing, noticing what, if anything, has shifted since you first checked in with your body. And then again, bringing attention to your breath. Again, just observing, has anything about your breath quality shifted? Bringing your arms down by your sides again. Inhaling, arms up overhead. And then as you exhale, you're going to twist your torso to the left, bringing your right hand to the outside of your left thigh. Just hold here for a moment. If you'd like to and it feels good for you and you have a chair back, you can put your left hand on the back of your chair and get a little bit more force in the twist. Again, doing what feels good for your body, what it's asking for. And just noticing what your body is telling you. On your next inhale, come back to center, reach your arms up overhead. And then bring your arms down by your sides again, absorbing the impact of that stretch. And when you're ready, inhale, arms come up. And then turn your torso to the right, left arm coming, or left hand coming to the outside of the right thigh. Resting your right arm to the outside of the right hip, or if it feels good for you, grabbing onto the chair back and getting a little bit more of a forceful twist. Letting your neck come with you, looking over your right shoulder if that feels good for you. Inhale, get a little taller if you can. Exhale, see if twisting a little deeper feels nice. Noticing if there's any tension you're holding in your body as you're doing this that's unnecessary. And then on your next inhale, again, reaching the arms up as you turn your body back to center. Exhale, bringing the palms down to the thighs. Once again, bringing presence to the experience of your body. And bringing presence to the breath. Lastly, bring your arms down by your sides. Breathe in, reach them up overhead. Exhale, bring your arms to that goalpost position. Inhale here, bringing your sternum up to the ceiling. And then exhale, give yourself a hug like we did at the beginning. Curling in, bringing your chin down, your elbows toward your lap. Inhaling, goalpost, sternum up. Exhaling, giving yourself a hug, maybe switching the cross of the arms, curling in. Inhaling one more time, goalpost position. And then exhaling, arms down by your sides or in your lap. And then we'll end just by checking in with the body again, as we did at the beginning of this extended practice. Closing your eyes down or turning your gaze down toward the tip of your nose. And starting with the breath, just checking in on those same qualities. The depth, how it feels to inhale, where you feel your body moving to allow for that inhalation to happen. Is your breath shallow or deep? How does it feel to track the inhalation from your nostrils up through your nose and down toward your lungs? And then redirecting your attention to your body, again, scanning from the crown of your head down to your toes slowly. Again, just observing. Finding what's there, acknowledging it without letting yourself jump into a state of judgment. And then you can bring your palm of either hand or both hands up to your heart. You're welcome to take a prayer posture with the hands, or put your palms flat on your chest. This position of bringing the hand to the heart releases this chemical called oxytocin, which can help with all sorts of things. But in this particular case, we'll have a moment of self-compassion. And in your mind, you can just repeat to yourself, may I be happy. May I be at peace. May I be free from suffering. And even if you don't mean it quite yet, you will one day with practice. Take a breath in. Exhale, you can bring your hands to your lap. And then when you're ready, you can bring your attention back to the screen. I hope you all noticed some positive shifts in that very short practice. As I mentioned in the beginning, there's barriers to adding something like this to your life, right? And when we have conducted a little bit of research, we need some more about specifically the caregiver population and the difference between the interest in yoga and the actual participation. What we find is there's a lot more interest than there is participation. There's barriers to participation. And we need to do more research in order to understand how to effectively decrease those barriers. However, there is a scientist who I find just fascinating. Her name is Wendy Wood, and she studies habit formation. And what she has found in her research is that the two best ways to form a new habit are to decrease the friction. That's one. So what that could look like is if you decide going to a yoga studio sounds nice for you, picking one that's close to your home or close to where you're working. You don't have to drive far. You don't have to go be in a bunch of traffic in order to get there. Or I'm going to send some links for you that will come out in the next newsletter for YouTube channels from teachers that I've vetted, taken a lot of their YouTube classes. And it could be something like bookmarking that URL in your browser. So it's just there for you. And then making sure your yoga mat isn't buried in your junk closet, right? It's easy to access. And then the other thing the scientists have found is that piggybacking a new habit on an existing habit can be incredibly impactful. So when I was first learning to meditate, I sandwiched it between making my coffee in the morning or brushing my teeth in the morning and making my coffee. So I was going to brush my teeth every day. And Lord knows I was going to make my coffee every day. And so putting it right there helped me really solidify its position in my my daily routine. So know that it's okay to take little bite-sized snacks of yoga throughout your life and add it into your day where you're able to. But if it's something that seems appealing for you, consider finding a way to solidify it into your routine so you can really see how magical it can be with consistent practice. Okay, and I got just a minute under my time. Here's some references if you fancy reading any of them, but I wanted to save a few minutes for questions. So you can go ahead and unmute yourself and fire away if there's anything you'd like to ask.
Can we see the references again?
Sure. And I can send this to, sorry, it's so small. There were a lot. I think Susan, the PowerPoint will be available as well. Is that correct?
Yes.
Okay. So I'll make the slides available too, and it should be a little bit easier for you to read.
Hi, I guess I wanted to ask, are there any things that folks should like try to be aware of if they're like mostly practicing at home? I started during the pandemic and it became a really helpful thing. I really never thought I would get be into yoga, but I am, and so I guess now just like doing it like 3 or 4 years, like the basic stuff I kind of know like what I'm supposed to be looking for, but I guess as you like try different poses and things, what are like things to keep in mind?
Mhm. Well, as a physical therapist, I'll give you the famous response of "it depends," which is really true all the time. But it depends. I mean, if you have any concerns physically about you and your body, of course, I recommend seeing a physical therapist. There's a lot of us who have a yoga background also, so I'm sure it would be quite easy to find someone in your neck of the woods who has some experience with yoga, either just as a even just as someone who practices it, right, with their physical therapy brain can help you through any specific concerns that you have. Um, I think really just the number one rule is try different things and pick what feels right for you. You know, when I first started yoga, I was really into that Ashtanga yoga I mentioned, which I lovingly explain or describe as CrossFit yoga because it's really physically intense. And it was great for me for a while, and then things happened and it wasn't great for me anymore. So now I've turned toward a different type of practice. And I get my CrossFit type kicks elsewhere in life. So I think just feeling really free and empowered to pick whatever feels good for you. Um, the only other thing I'll say, and I tell this to my patients all the time, is if something's hard, it probably means you should be working on it. So I think a lot of us tend to trend toward things that are that we're naturally good at, but the postures or the practices that are more challenging, I find those often point toward what our bodies need. So by no means do I mean doing that if it's painful, but just a little bit harder for you. It's probably a good call to keep practicing and paying attention.
Awesome,
I hope,
thank you.
yeah, I hope that was helpful and answered your question as best as I can.
Alexandra, could you explain perhaps what might feel hard, what that might be, and how you would work with that? You suggested that, and I'm wondering
Mhm.
if you sort of fill it out for us. What might that look like?
Sure. So a personal example for me is sitting still was hard for me. I couldn't just sitting there and not doing anything, being in the more relaxing positions was really hard. Not for my body, but it was like there was a pinball machine in my head. And there still is some days, right? So I kind of avoided those practices, but really it turned out to be what I needed. I think an example for physical practice, something like balance, right? If balancing is challenging for you, it doesn't necessarily mean don't do it, right? It means, oh, that's something I should probably be working on because I want my balance to get better, and it's not going to get better if I'm not challenging myself. So something like standing on one leg, right? Of course, keeping safety at the top of mind as well as you're doing that.
If nobody else has other question, I would like you, if you could, to address how you might use this with your person that you're caring for. What
Mm-hmm.
would that look like?
Um, well, again, it depends. I think the of course, particularly with patients with dementia, it can be challenging the spatial awareness and the ability to follow verbal instruction. So it depends on, you know better than anybody what the person you're working with is capable of. And if they respond better to watching you do something and mimicking you, or maybe you even assisting their bodies in different ways. So it depends on their capacity. I think a lot of people with a diagnosis like dementia, as things progress, we stop moving, right? And the body likes to move. The body needs to move. It's built for that. My patients who come in and say, my back hurts. Like, when does your back hurt? When I've been sitting at work for 7 hours. Well, yeah, we're not meant to sit all day. It's not what we're built for. So I think it can look really like anything. In my mind, I'm picturing someone who's a little bit further progressed and might need some hands-on cueing on how to move their body. Something as simple as reaching overhead, I find, has a really dramatic impact on our ability to breathe and feel good um, in our upper halves of our body overall, right? So something as simple as that, reaching arms up overhead, bringing them back down with an exhale. And then if your person you're caring for is capable, these videos I'm going to be sending, or the YouTube channel links I'll be sending over to those at Daybreak to then send back out to you. There are so many different uh, types of practices on there, and really something for everyone, assuming that the person that you're caring for has the capacity to follow the verbal instruction or the visual instruction. Practices where you're totally sitting down, so if you're concerned about falls, you don't have to be hovering around them as much. But there's a lot of variety. I don't know if you had anything to add to that, Susan.
You know, I was going to say that it's not unusual for a dementia patient to be willing or able to follow your movements.
Mm-hmm.
So that's just something to bear in mind, that if you slowly lift your arms up in front of them, they may copy you,
Mm-hmm.
example. So you wouldn't explain it, perhaps, but you might just model it
Mm-hmm.
as a suggestion. And
Mm-hmm.
the other thing I was going to say is, I think when you do yoga with somebody with cognitive impairment, to the extent you can synchronize your breathing with theirs, or in some way convey to them a nice, gentle breathing pattern. Anything that would come to mind, you know, like putting your hands on your chest and breathing in and lifting your chest and so on, or even putting your hands on their chest and perhaps giving a little weight to their exhale and lightening up your hand with the inhale might be a way to convey more attention to their breathing.
Mm-hmm. Yeah, I agree. I think the tactile cues you're mentioning can be huge, and um, you have much more experience than I do working with this population, Susan. But I find with pretty much all populations, really demonstrating yourself, right, monitoring your breathing cycle and habit, there really is a bit of a contagious aspect to that, without a doubt. So being aware of the mirroring that might be going on
Mhm.
and using it to your advantage.
Alexandra, I'm Karen. I work with Daybreak. I can also see therapeutic touch being a part of it. In other words, when you had us lift our arms up, to have our arms under their arms,
Hmm.
you know, and you talked about hands over the heart. I think therapeutic touch, in addition to the yoga movements, could be a real good connection for caregiver, care receiver, in addition to the physical aspect.
Mm-hmm. I absolutely agree with that. I think there's a bit of oxytocin capacity there too. And what I find oftentimes is less can be more. So there's often a temptation to kind of muscle through someone, but oftentimes, you know, if you can, being more of a guide, right,
Yeah.
as opposed to you doing all the lifting, can have an even greater impact, sort of giving a little bit of direction as opposed to pulling them along with you. But yeah, I totally agree. Thank you for that, Karen.
And if yoga is about yoking the body and the mind, to feel that connection with your care receiver, sort of yoking your body mind to their, if that makes sense, you know, in this sense that is really very right brain, that I think yoga really does, if you practice it, you experience, and that's something that can really influence your relationship with them.
Mm-hmm.
with your care receiver, and even bring some movement, something, you know, that you might not expect.
Mhm.
It would be lovely if any of you have any experience trying this for yourself or with your care receiver, to share. It would just be very special if anybody wanted to share like that.
Well, I'll add one more thing if there's no one wanting to share, and that's that the way I think of what you were just mentioning, Susan, it's like when you're with someone that you love and you ordered something at a restaurant that's really, really good, and it's so delicious that you want them to try it too. Like you got to try this, it's amazing, right? Um, that's kind of how I describe the yoga and mindfulness. You get a taste of it and it feels so good, and you just you want to share that goodness with um whoever is with you. So um aside from the benefits of doing these kinds of practices for yourself, exactly what you're saying, it's there's that contagious aspect of it, of sharing it with whoever you're caring for.
I could just say that I lead my husband in physical therapy exercises, and we do them together. And often in between them, I add in a deep breath into our bellies and a long, slow breath out a couple of times. And I just intersperse that in between other exercises. And I feel all kinds of benefits for both of us from doing that.
I love that, Nettie. Yeah, breath can be huge. Breath is incredibly powerful, and an underutilized tool I think we have in our toolbox for sure. And on that note, too, in the class I teach on mindfulness for pain, we talk about mindful movement in general and bringing that awareness to the body as you're doing the physical therapy exercises can be, I find anyway, a different experience from my patients when they're directed in that way. But mindful movement can be with walking, with weightlifting at the gym, and absolutely with obviously physical therapy, but also physical therapy exercises. So I love that integration of the breath with that awareness of the practices as well.
Yeah.
Oh, thank you for that, Nettie. Yeah, I think we have this idea that yoga is something that is complicated or difficult, and I really hope we did get across today that it's anything but, if you will.
Mm-hmm. Yeah, there's this thing in from Deepak Chopra that we think these types of practices are challenging, but they're only challenging if you have a goal that you're not, because if you have a goal and you're not reaching it, then it's a challenge. But if you're just doing it to do it and to be there, you can't fail at it, which means it can't really, it takes the challenge aspect away from it.
Thank you so much, Alexandra, and yes, thank you so much. And we look forward to sharing your slides and your links. Thanks again. And we will have this recorded for people to watch again or invite others to watch. Thank you. Thank you very much.
Thank you, everyone, for attending.
Thank you.